I'm really good, but I can't hear you. आपका शायद mute पे है.
Hello, Assalamu alaikum. How are you?
I'm very, very good. I'm so excited to speak to you. First of all, you look so lovely.
Thank you so much. I just got ready for the meeting actually.
Excellent. Thank you so much.
So I was just, you're welcome, you're welcome. I was having a lazy Sunday and then I realized that, I have to get up for the meeting and stuff. So there's this stuff going on in my house, renovation and stuff. So, yeah. So I'm really excited. I'm really looking forward that,
Yes,
for this
absolutely.
meeting and for this platform. And I'm happy and I'm obliged that you actually contacted us.
Yes, I read about your work. I heard from Hina. I was fascinated by what you're doing, but I wanted to know in person as well. I mean, why did you get started? What have you done before COVID? What are you doing during COVID? What do you want to do after COVID? And Raza is supposed to join us as well. And I think there's an organization by the name of Hope. Maybe you've heard of it as well. And they somebody from their organization will be joining as well. And last, somebody from the Do School in Berlin would like to join just to see what we're up to, what we're discussing, why we're discussing it, and why we want to tell this to the world. So eventually, I wanted to keep this a little bit private for now. I'm not sharing it on social media. And after we're done, I want to basically take some of the key takeaways, some insights, and then put together like a paper or maybe publish an article with your consent. So that's the eventual goal of this. So let's wait 5 more minutes. And then maybe if you want to take like a quick coffee or something, this is the best time to do it because we have 5 minutes. And then, at 5, within 10 minutes, we'll start. Okay. Okay.
All right. See ya.
Hi, Eva.
Thanks, long time no see.
Look at me with my fancy logo at the back.
I love it. I really like it with the bright yellow too. I should do that. I wish I had it. That's so great.
Yeah.
Aww.
Today must have been crazy for you with all the different events happening. How many have you attended so far?
It's Sony. Actually, we've been tag teaming. So I joined Christian and Shannon's, and then now yours, and then there's one more that I might join later. They're figuring out some tech stuff. But then, yeah, the rest of the team has been involved yesterday and earlier today, and we'll be involved in more tomorrow. So,
Got it.
yeah.
Got it.
Thank you
And
so much for doing a due day event. I'm really,
I'm really excited. So we're going to be starting in another 2-3 minutes. We had another participant. She just wanted a little bit more time. And Raza, who is already here. And just to give you a brief background, Eva, these three people that I have chosen have been representing various vulnerable communities. They have worked with HIV communities to provide them with healthcare products and services during this lockdown period because a lot of them could not be reached. A lot of them have worked with transgender people who are very, very they're on the fringes of society in Pakistan. So we wanted to hear what were the daily struggles. A lot of them rely on sex work sometimes, and so their income was also impacted. And so we wanted to hear how these entrepreneurs tried to help them out and see what kind of solutions came to solve, and now what the future looks like now. And how we can continue to elevate these communities and help them come out and emerge during this time.
awesome. Thank you so much. I'm so, and Raza, I'm so looking forward to learning with you and supporting from the Do School. We're sharing out, actually, Raza, before I talk at you, can you hear okay?
I think
yes, I can hear you guys. Yeah.
Hi.
Good to see you.
Raza.
Yes. Thank you. Thanks for.
room.
Thank
Yes.
goodness. I know Raza, you and I are not doing much for the colorful backgrounds. Thank goodness.
How are you, Raza?
I'm fine. I'm
calendar
fine.
invites. Sorry.
I'm good. I'm good. How are you, Sabah?
I'm very
And good to see you, Eva.
Yeah, really good to see you. Good to connect. Yeah.
Eva is from the Do School. I represent Aurat Raj, and we have two more panelists who are going to be joining, and they will introduce themselves. And maybe since we're already past 8, maybe you can start us off and tell us a little bit about yourself, what you're doing, which communities you represent, and where does your work really concentrate on?
Okay. First of all, I really like the name, Aurat Raj. And that I've seen this movie almost 2 years back. And I love that movie, really. The concept behind, that movie was really, really good. And I know there were some technical things behind that, but it was not technically very sound. But beside, other than that, it was very, very nice movie.
Yeah.
So yes, I'm working with a community-based organization, and the name of the organization currently I'm working with is Dostana Society. Dostana means friendship in Urdu language. Yeah. So, but mostly this word is more attached to gay and bisexual men in Pakistan and or in the subcontinent means like India and Pakistan. So when it comes to this particular term, Dostana, it means it's a gay term. It's a gay term between two men. Yeah. So so the name of the organization is Dostana, and I'm working with the development sector from last 10 years almost. I started working with a technical support agency. The name of the technical support agency was NAS Foundation Pakistan. And we have developed, I was a part of technical support team, and we have developed 6 different community-based organizations all over the Pakistan. And it was mainly developed for 2 kind of populations. One was MSM. MSM is this term is mainly used in globally for male having sex with the males in the development sector. So in Pakistan, for MSM and transgender people. So we have developed like 3 organizations in one of the provinces in Punjab and 3 in Sindh. So the speciality of these organizations were like, all the organization was run by and owned by the community. The board of directors, all of the board of directors were from community. And if that particular organization was working for transgender people, the whole staff was transgender. Means all the board of directors and program manager and the finance person and even the the office girl was also, since now also they're also transgender people. And even in MSM organizations, that's the same pattern. So but the most interesting work which I really liked doing it was in Karachi in my last 2 years. And we have developed like LBQ women, lesbian, bisexual, and queer women organization, because there is no organization in Pakistan as such, which is like openly declared as an LBQ women organization. And the name of the organization is Q Karachi, means Square Karachi. Yeah. So it is also run by the community, because we were the concept behind developing this organization was it should be run by, because community knows better how to do their own work, and men don't have any idea how to force or guide or any woman. They are empowered and they know how to do their own work. So what was behind was we were just, because we were established organizations, and we were having a structure, and we were there to support them in a way that providing them the safe space and providing them the administrative services until and unless they get independent. But I'm really, really glad now they are independent and they are working on their own, and they are running a good circle in Karachi. Now they are they are starting working with the other organization, LBQ Women, in Lahore and Islamabad as well. So yeah, it's going on. We are trying. Yeah.
So there's community building, there's advocacy, there's research. All of this is combined in your work in all of your organizations.
Yes.
Absolutely. And you've worked with a lot of UN organizations. You've also worked with also the development world for the last 10 years, if I can
Yes. We started working with the Global Fund, and Global Fund started working in Pakistan. There was a GFATM grant round 9. It was a regional grant of South Asian countries. It was based in, and Pakistan was one of them. And we were the main people from the NAS who started working and developed all these organizational structure of community-based intervention. Yeah.
Awesome. So if I can ask you, how was it personally for you during this whole pandemic? How did you deal with it? Then how did your community deal with it? What were the challenges that they went through? You can speak about different organizations, different communities that you are involved with, and just give us a summary of what March onwards has been like since till this day.
Okay. So the thing is because in Pakistan, openly working on sexuality, it's not an easy task when it comes to homosexuality, whether it goes to lesbian women or gay men or bisexual men. It's not legalized in Pakistan. So we cannot work openly in Pakistan as far as the sexuality things are concerned, because we have punitive laws here in Pakistan, like Article 377, as it was in India as well. Now it's not there. I hope, one day in our age we can see, it should not be in Pakistan punitive laws as well. So the thing is, during this whole work, because we are mainly focusing and working under health umbrella, and that is more of HIV testing and services. So we are providing these services to our own community, like gay, bisexual men in Punjab. So what happened to you during this pandemic, because we are mainly focusing on low socioeconomic background people, those who don't have homes, or those who are street based, or those who don't have the basic medical facilities, and those who are mainly involved in sex work. So we are providing. So what happened during this pandemic was like, most of the people who get identified as HIV positive people in Pakistan, in our community, they were from a very low socioeconomic background, and most of them, like, they were having, like, either they were on dependent on the sex work, or or they used to be, like, most of them were street based. So during this whole pandemic, what happened was, like, the employment opportunities get reduced, and people get locked down into their houses, and, like, the income level get, like, reduced. So the this specific population get really affected. And what happened is, like, because we did the testing, and they always used to like think that, like, this is more like a community based organization, and, like, they can help us if it's in a difficult time. So they used to come even in pandemic also, even in the lockdown also, they always used to come to our community based organizations or drop-in centers, and they used to ask us, like, they don't have food, they don't have shelter anymore, so, like, they need help, like, from us. So what we used to do is we used to ask the government, we used to ask different community people to help us, to give us, like, the ration, food item, basic food items, and, like, masks and sanitizers. And for, like, and the ration, like, was for, like, either it used to be for 50 days or for a month stock. So what we used to do is, like, they usually used to give us to our, like, drop-in centers, and we used to deliver it to their houses. Either we used to call them, like, on a van, we used to take the ration bags to their houses, and we used to give it over there. But, like, in the meanwhile, in collaboration with another organization, we thought, like, the research should be like, should be a main part of it. So we started writing different concept notes on, like, the COVID effects on the LGBT community in Pakistan. So we started doing it recently. We are doing it right now. So we are doing interviews from all over the Pakistan, and I hope so, like, within a month we will get the results. But I was personally conducting interviews, and honestly, like, most of the people lost their jobs during this pandemic, and, like, they were in very, like, bad condition. And most of them, like, they used to have these symptoms of corona and these kind of symptoms, but they were not able to even go to hospitals, and they didn't have, like, these the basic uh, resources to get tested, because the corona test was very expensive during the pandemic. Yeah.
And hospitals already are a place that are very scary for a lot of transgender people, especially because, just to give you a little brief background, we've had cases where when a transgender person goes, they refuse to put them in either one of the wards because the staff can't decide which one they belong to. Sometimes there's a lot
Yeah.
of, in the process, many people have died because they wanted quick, urgent treatment, but the staff was just unwilling to accommodate them. And I think the case remains the same with corona. I think if somebody's infected, there's the taboo of belonging to this community, and then there's the taboo of having COVID. Both together makes it really, really difficult for people. I also wanted to speak to you about providing access to HIV related healthcare. Was that something that was also affected during this time? Did you have to kind of like, if there were supplies or medicine or anything to keep this particular community healthy, what could have been done? Or was the government involved in providing these facilities, or they had also kind of closed their eyes to it?
So the thing is, like, I really wish that person must be here to
Yeah,
speak
we
about the
just
transgender
texted. She was
people.
right.
Yeah,
Maybe
yeah.
there's
So yeah,
electricity issues, so maybe she's
yes, yes, yeah. And because, like, me and her, we both were, like, working together to provide this ration support and food
Mhm.
support to, like, she was working for transgender people, and I was working for the people living with HIV and gay and bisexual men in Lahore. And it was not easy to do that, because there was a very a very strong fear inside their mind, that if they can go to, or if they will go to hospitals, even if they don't have it, they will get it from the hospital. So like, mostly healthcare providers used to say this, that, you should stay at home and you should not come here. But the thing is, like, the people who are working on the daily wages, their life is not very easy, because I might be have some savings of, like, 2 or 3 months, so I might stay at home. I might have the electricity or basic food facilities or maybe basic medicines. But for the people, those who are earning on their daily wages, it's very difficult for them to survive, because they daily go out and do, like, their labor work, and they earn, and, like, with that income they eat. So for them it was not an easy time to be. So yeah, it was very difficult time. And, like, of course we started, because within a month we started realizing that, like, it's a very difficult time for our community, and, like, we should call out to the government and, like, the people around us who can help them. And we started writing it to the government, because we are doing a project with the government by providing, like, the basic testing facility to the key populations in Pakistan. So what happened was, like, these governments, or maybe, like, some UN agencies, they and, like, most of their employees used to, like, they were also in lockdown. And they always used to say, like, we have a procedure, we have to procure things, that it will take time, even, like, the basic mask or sanitizers, if you need help, we need to, like, put a tender and in the newspaper, and it will take a month or two, and then it will come. And honestly, Sabha, like, now we are receiving the PPEs, like, precautionary, yeah, these products, and, like, the masks and the sanitizer and that everything. It was very much needed long back, like, in those 6 months. And like, whatever we have right now, we are providing it to the community on the regular basis, even now also, because, like, this precaution should be there, because, the people who are living with HIV, their immune system is not, like, very strong. So they need to be like, hi, person.
By the way, Pooja, she dressed up primarily for this meeting, so she looks absolutely gorgeous.
And I'm sorry for being late, but I was here
Really.
for anybody else, but then my system broke off, and something happened, something wrong with the internet connection and all. So I'm sorry for being late. So hello everybody,
Worries.
my name is Musa.
So Raza was basically taking us through what his communities went through during COVID, and we cut him off when he was telling us something important. So I'll go back to you, Raza.
Yeah. So the thing is, like, it's not very easy for the people who are living with HIV. Their immune system is not very strong. And like, during this pandemic, with all the economic and psychological impact on their personality or their body, physically or mentally, it was very hard to survive, honestly. And it was not an easy task. And, like, for the organizations, especially these community-based organizations, they have very limited resources, like, and, like, it's not easy to provide each and every person to go out. But again, like, within in our own capacity, we were trying our level best to do it. And we, like, we did a lot of work. But I really, like, salute those people who used to go out and they used to distribute ration bags or food items to the people who are in need in this difficult time. Like, because otherwise, like, if someone is not dying with the corona, they might die with the hunger. So, like, it's very important, like, they, in this difficult time, as a community, we need to stand with each other and help each other. Yeah.
Absolutely.
And Fursan, like, Fursan will definitely tell you the whole detail. She was doing a lot of work, and that was very inspirational, actually. And she did a lot of work for the transgender community.
Absolutely. So take us through your own introduction, your profile, what you have been up to before this pandemic happened, and what happened during this time, and how you have made your community come out stronger with your inspirational work?
Hi, can you hear me?
Perfectly.
Okay. Hello, everybody. My name is Horsan Bayareli, and I'm an activist. I'm basically from Islamabad, but I'm settled in Lahore. It's been um, almost a decade that I've been working in the social sector. And initially, I've been working with the HIV and AIDS sector. I've worked with UNDP, UN AIDS, and Global Funds particularly. But now it's been like 2.5 years that I've been working with ICJ, International Commission of Jurists. And currently, we're working on gender-based violence, particularly on the transgender community, but we are actually focusing on LGBTIQ community as a whole. So also, I'm running a theater group called Notanki Production, and it's a trans-led, trans-based organization in which we try to focus the lifestyles and issues and problems and um, routine stuff what the community in Pakistan goes through, and we try to depict that. But unluckily, we had 2 to 3 performances planned in this particular year, but right from the beginning, since the pandemic happened, so we couldn't do it. So yeah, and before pandemic, as I've told you earlier, that I've been working with this whole thing, and during pandemic, I guess initially, I as an individual, we weren't really aware of what a pandemic is. Especially living in a country like Pakistan, we weren't really told about this thing. I mean, like, we weren't any awareness, we weren't any, we don't have any disaster management over here in the country. Like, government doesn't tell you that what's going to happen. Government doesn't have a plan to tell you. So when this whole thing happened and the ban happened, now everybody was very strict when it comes to the protocols that, you have to wear mask and everything. But I'm particularly talking about of the class which had something in their pockets, and they had their kitchen filled and they had their refrigerator filled, so they could have easily followed the protocols. But the point is that when we talk about a community which actually earns daily on daily basis, and they do sex work in the night and they do their breakfast in the morning, so that's how their routine is. In such circumstances, if you announce or declare the total blackout, or total ban on everything, or it was a curfew situation over here in Pakistan, so that community suffered a lot. I mean, in the very first week, we tried to make contacts on social media. We tried to gather people. We made WhatsApp groups. We gathered registrations and ID cards and everything, and then we tried to focus the spots where we have to go. And initially, it was difficult because I started working as an individual, and I was mainly managing everything. But after 1 or 2 weeks, then people gathered, and there were people and kids from universities, like Lums University students and BNU students and other people, and especially one of my friends, Zunaira Khalid. She is also an individual, and she was studying abroad, but she was here in Pakistan at that time. So she has really helped me out, and she went through you know stuff like she arranged an Insta meeting, and we included a very famous singer over here, Ali Sethi, and we had a live session with Ali Sethi, and we grabbed audience, and when we so that's how it all started. But then obviously different organizations and individuals started coming forward, and they joined hands, and that the movement became stronger. But then after 2 to 3 months, when this whole Russian thing was happening, and we were reaching the database community, we were reaching the sex worker community, we were reaching the people who were actually standing on the roads. And I still remember, I even discussed this with Raza as well, that when we used to go to roads to distribute rations, there were general public standing on the roads. I could see ladies and girls and kids standing on the roads and begging for ration. And they were not regular beggars. You could see that by their attire or something. But the hunger stuck them so badly that they came out of their houses. So this was the situation that we were coping up over here. And then luckily, since we are working with international NGOs, then the international donors took part in it, especially UNDP and UNAIDS, they came forward. And then APLHIV and other organization, they came forward. Then they strategized the things and everything. So that's how it happened. But also one thing which I noticed during this whole tenure, that um, if if this thing would have been done with a bit of discipline, like if there are 4 or 5 organizations in Lahore, particularly working for the trans or LGBTIQ community, if they were interlinked with each other and they had a certain system of registration, and people who has gone the support and who needs the support, and where does this person live, or what's the economic situation right now, and it could have been done more with more smooth functionality. But see, as I've told you earlier, that we weren't prepared for this. We as an activist were even prepared for this. We didn't know. And even our state or government, they could, all they used to tell on news that, these many people have died today, these many people have admitted to the hospital today, hospitals are full, and, just be home, take care of yourself. But they weren't telling that what do you do by living at home. I mean, they could have, or they should have come up with a strategy. They should have told the public, they should have told the nation that, what can you do? And then later on, public service messages came on, and, this all happened after like 5 or 4 months. And I mean, I guess after 6 or 7 months, it remained over here for like good 6 months, I guess, if I'm not wrong. And then they introduced the smart lockdown. Schools started getting opened, and universities were opening, and small businesses were opening. So things started getting normalized at that time. But when this thing was at its peak, there was no such thing by the state introduced some programs and some funding programs, but they were so tough, they were so hard. Even a person like me, I opened up that portal which state has introduced, that was called Citizen Portal, and that was so difficult to operate. I mean, in Pakistan we do have gadgets, community knows about WhatsApp and Facebook, but they cannot use those gadgets. They don't know how to read and write in those columns. And you giving them a column of like 50 to 60 columns, and then this interface changes, and then the other interface comes. That was so difficult, and also that didn't work out. So yeah, I guess uh, as an individual and as an activist, I think that we should get prepared for something like this in future as well. Since we are hearing news of, this, there's another wave of COVID which is coming back in this particular region. So I guess now we are a bit prepared that what do we have to do, where to start and where to end, and how can we manage the community. One thing which really good happened during this pandemic, that community came really closer, you know through social media and WhatsApp groups, and people were interacting with each other on different forums, online meeting stuff started happening. So, everybody was on laptop, and they were, talking to each other, and, links were being made. So that's the good thing, but that all happened on civil society level, that all happened on community-based level or NGO level or individual level. There was no support from, big name states or anything. Sorry.
I think we lost you for a minute. I wanted to ask how you manage your mental health working with people and hearing their stories and hearing their struggle. How did you personally deal with your positive mental health so that you could help everyone?
Yeah, and actually,
That
before,
was,
is it
Yeah.
okay if I pop in before? I'm taking so many notes from this conversation. Thank you so much, also Saba, for letting me join, and thank you. Yeah, thank you so much, Raza. Thank you so much, Kursam, for I'm learning. And Saba, I'll loop back with you because I would love to also call out your organizations as part of We at the Do School, as we're publishing like lessons learned from Do Day and We Emerge Week, there were a few themes that I think are so related to the work that you're doing. So I would love to just, at the very least, give more visibility to what you've done, and what you've done, that's worked.
Thank you,
But
Eva,
Saba,
for
let me
joining.
know. Yeah, absolutely. And let me know whatever more comes out of the conversation too.
Absolutely.
I think I'll have to join another Do Day event in a couple minutes. So I'll stay and hear the first part of what you're sharing, Corson, and then I'll pop out gracefully. I won't say anything. I'll just pop out.
All right. Thank you, Eva.
Yeah, such a treat.
Thank
Thank you.
All right. So on mental health for both of you, anyone can go forward and talk about their own positive mental health, because unless you've helped yourself, you can't go and help other people. So how are you keeping yourself strong and like inspired to do this work?
I'd like to listen Raza first on this topic.
Thank you, Hussain. I would love to listen to you, of course. And the thing is, it was not an easy task, and it was not an easy time for us as far as, this mental health is concerned, because there was a lot of pressure for the people who were working for the community, because everyone was looking forward to us. And they were they were thinking that, we can do something or we can support them. And it's not an easy task to sit on a chair or sit in a position where people look forward to you, and it's hard for you to cope up with that. It's not easy. Honestly, it's not easy. So I'm really glad during that whole time, the other people who were working with us, especially Horson and other people, different activists and the supporters, especially who were providing support to the key populations, was I really appreciate them. And but the thing is, as far as I'm learning therapy, and I'm uh, like uh, doing different courses in that. So now, with the passage of time, I started realizing that mental health is a very, very important thing, for especially for the key, everyone, of course, but for the key populations, because they have very different dynamics, and they actually need these kind of support. So, with the passage of time, we started realizing it, and we started providing the counseling services to the people during the pandemic on Zoom, or maybe, through different sessions or online. Of course, we used to, talk to our friends, and, sometimes we sit together as well, following the protocols. and to because it was very hard time. We the social people are not used to, to sit away from each other. We are the social bees, to fly around each other. So it was a difficult time. Yeah.
And a lot of the people, especially transgender people, they're not living with their families. They're often living,
Yes.
they're away from
Yes.
their
Yes.
families. Either they've been kicked out of their family, so they have to
Yes.
kind of like deal with everything, their economic and
Oh,
financial situation, their emotions, food for the next day. It can be really difficult.
it was very difficult, because, most of the transgender community, they are living in communes.
Mhm.
And their local communal systems and local communal places where they are living together in, maybe 5, 6, or 10, or maybe more than that. So for them, it was very difficult to, pass on through that time. Yeah.
Thank you, Raza. Um, are you ready, Kursan? Can we?
Yeah. I'm ready. I guess Raza has explained the situation in a very good way. Since I and Raza were almost together in this pandemic, and we were we kept on discussing things with each other, because Raza saw that Raza was with me in all that, in that manly stuff, because when there is ration coming from somewhere, and then you have to unload it, and then you have to keep it, and then you have to, I was calling people, and Raza was like distributing things to other. So we were all together. And Raza also mentioned that uh, at times I believe that activism is is a tough job, and it's also becomes thankless at times, because people come to you for their issues, but you don't have anyone else to go until unless you're paying somebody who's a therapist and you're going to him or her for your mental health. But in community or within your circle, you can't find. But luckily, we have friends. We are very lucky that we can discuss with each other, and even in the pandemic we were connected online, and we were connected offline as well at times, following the protocols, because we were all being safe. We were living in our home, so we could meet up, and we could sit with the distance and all that. So yeah, we were discussing things with each other, and that's how our mental health kept going. But as you mentioned earlier, that it's really a tough thing. I mean, like, you're going through a pandemic, then you're living away from your family, and you're helping others, and you're seeing things every day. Every day people are asking you for food and basic necessities, and that makes you realize that, yeah, hunger has struck us like anything. I spoke to one of the community member, and I asked her that, do you need any medicines, do you need any Panadol, Brufen, or anything, अगर आपको कोई भी मसला है. तो she said that, I don't care about medicines, I need food. I haven't eaten anything from last 3 days, I don't have anything. She said that I don't even have tea or sugar at my place, so I can make tea and have it. So can you just give me food? I don't need medicines. If I don't die of corona, I would die of hunger. So that was really a thing which about which I kept thinking all night. And I discussed this with Raza as well, and with other friends of mine as well. So yeah, I guess social setup, it depends upon your social setup. If you have a good friend circle who can understand you, then your mental health can work good. But
But kudos.
otherwise, over here,
You
we don't
did a
have any
great job.
set standard or system that, that we can talk about, until unless you're not paying somebody for your therapy or your counseling or something. So yeah.
And you're a creative person. You couldn't be creative during that time. Did you put together any plays, anything that you could do virtually?
Yes, we kept on planning things, and we also did few interviews and few plays. Um, I wrote a lot in that time. Yeah, I was also thinking of different stories, and meeting different people through online. So I was writing things, and I kept preparing and kept preparing myself that when the pandemic is over, we are going to depict these stories. Because pandemic, in my life, it came for the first time. I didn't, as I told you earlier, I didn't know anything about it. It has happened in the last century, would have happened in Indo-Pak as well, but we didn't know about it. So I learned a lot through this. I wrote a lot. I wrote like 3-4 different stories, and kept working on the scripts and stuff. um, so hopefully, inshallah, we are going to do something virtually now. We are planning to actually document our previous theater plays, which were not accessible by so many people. So we are trying to make them online. So now we are going to do the online theater that we realized in pandemic. So we're going to do that soon.
It's really exciting. Acha, so because we're already, I think, close to our ending time, I wanted to end on like a really positive note. And I want to ask you guys, what are solutions that can help these communities emerge stronger? Like, do you see that there is learning from this time period? What can be done in the next phase? And for the next wave or for the next pandemic, how do we prepare for the future? And because I think Hursan is gone on mute, Raza, I'll pose the question to you.
Yeah, definitely. I think with the last experience of pandemic, we have learned, like, we need to be more structured in a way, and we need to be more linked in a way, virtually especially. So because that was more like a learning period for all of us.
Mhm.
And now this is totally a new horizon for the whole world, that if we are not present there physically, then how we can connect with each other. So it's a very good medium. It's a very strong medium to be with each other and to let the other person know that we are there for you. and we are just next to you, if not physically, but I am there, we can talk to each other, we can see each other, and we can support each other. So I think the proper structure needs to be built up within the organization, especially the community based organizations, and to help those people who are in need actually. With the passage of time, we can develop those resources. Previously we used to think that we have to travel and go there and do this and talk to the people. It's very necessary to be present to next to the other person, but now this is totally like a new world and totally a new normal for us now to be a part of it and to help each other. I think we need to be more structured, I think, in Pakistan.
And we see
That's the
that
positive.
lack of structure in all of our failures. So when we saw the airplane crash, there was no way that the
Hmm.
victims could seek relief. There was no structured way of dealing with that
No.
emergency. And this particular time, I
Yes.
mean, I think for Pakistan has been very, very critical and very, very for people in
Yes.
Karachi, the floods on top of that.
Hmm.
So I feel like people who are already living on the phrase or fringes of society, they just
Hmm.
went even below. Like now, I see it with my eyes in
Yes.
Karachi. You can see it daily. The amount of beggars have increased, and so like the work that we all have to do has to continue, and I think it has to scale and get bigger.
Hmm.
And I'm really excited, by the way, Raza, when you publish those interviews or when you publish those insights, please share with me as well. I'd
Yes.
love to
Yes,
understand.
definitely. Definitely, I will share with you the whole research because, like, all the interviews are done now, and it's in a process of analysis in qualitative and qualitative. So, like, when the report will be ready, I'll definitely share it with you.
Awesome. All right. So, what could we do to come out of this? And what do you see as a solution for the future?
I believe that one thing which I really think is I'm happy that this thing came out of this situation, that we got connected. The community got connected with each other. I didn't have so many numbers. I didn't have so many contacts with me. So I got to know people. Now I know that where does this Gori live, and what does she do? What's her age? What's her economical status? And what does she do? And so I have a complete data now. So what we can do with that data, I'm technically speaking, that what we can do with the data is that, God forbid, if something happens like this in the future, so we can reach those people. I can reach those people on my own. I don't need a third party, or I don't need another person to go to them. This is the good thing. Also, um, uh, I guess the organizations have come closer, because they were discussing things with each other. They were matching their data with each other. They were asking each other that this is the list that we are catering, and that is the list that you are catering. So that's a good thing, and community learned a lot. Community got to know about that how to manage on their own, because we told them about sustainability as well. We told them about skill building, a lot of online courses that were introduced by different organizations. Like I've been working with this online thing that is called Tabir, and they were working on educational and linguistics and all that. So that happened, and other classes happened. People got to learn about like I know a few tailors. In the pandemic, their shops were closed, and they were from the community. So what we do is that we made their pages, we got them connected with few clients, and now they're doing their stuff online. So now they don't have to go out and get a shop or something. They can work from their home. Same is the case with the people who are into beauty business. We made their pages, and now they're connected with the clients. They're linked with different pages, and people can contact them on online, and people have their contacts and all that. Also, I believe that as organization, we should come up with a mutual strategy which can prevent us from something like this in the future. Now we should all sit together, and we should come up with a strategy. Like I've told you, we do have data, we do have resources now. And The other thing is that every organization and every activist or working individually or with the organization should be capable of disaster management. We should have proper trainings of disaster management, any sort of disaster management. Like you mentioned, flood in Karachi. We knew that, monsoon happened, and everybody knows that flood comes every year, but we don't make any sort of strategy, state representative, they always come on TV and they say that next agle saal nahi hoga aur is dafa ho gaya aur nahi hoga, but that happens every day, every year. So we should rather come up with a strategy. Now flood is something which is a natural disaster. You can't really fight with the flood. All you can do is that you can make yourself technically stronger, so it doesn't come that way. But in these situations, we can make our linkages with the hospitals, we can make our linkages with the ambulances, we can make our linkages with the organization which are providing food or medicines and all that. These are the strategies that we can work on. But the good thing happened is that, there are so many organizations which I really didn't know about, but they came up, they contacted me, like, there's this organization called Helping Hands. So they offered their medical camps and at different places in Lahore and in smaller towns of Lahore as well. And then there's this foundation called Risk Bachao that works for the marginalized communities, and they provide them food. They are linked with the big hotels, and they collect food, not the leftovers, but the food which is not being used. They collect that from those hotels, and then they provide it to the organization. So yeah, we got linked with all these things, but still we have to come up with a good strategy. I'm afraid that we still don't have any disaster management strategy over here. Not on civil society level and not on state level as well.
So I heard structure, strategy, collaboration, networks. These four things can help us for the next. And are these lessons that you both want to put in your organizations? I've learned a lot for my own. Mine is a far younger organization than yours, but I feel like I learned so much during this session. And I really want to thank you for taking out the time on a Sunday. It was lovely, absolutely amazing talking to you. And I hopefully can share all of these together in an article and get your consent on whether we can publish this, because I think we know a lot because we're living in Pakistan, but the larger community, international community also needs to know what went. And sometimes I feel the development world only knows about some of these issues. I think the larger public should know as well. So hopefully we can all contribute and continue to do the work that we're doing and make sure that these communities are represented during this time. Thank you so much.
Thank you so much, Sabha. Thank you so much for doing this effort. And I'm really happy to to be a part of this. And I'm giving my consent to you. Please do.
In Lahore, we collaborate because my work is around sex education for adolescent girls. However, I really feel that, within schools, we have to talk about sustainability and gender equality and the inclusion of LGBT. However, these topics continue to remain so taboo, and only when we start educating our kids, and that is when they will become more open to the idea. Right now, there is so much close-mindedness all around. So thank you, and have a
Thank you, Sabha. Thank you.
You were saying something,
Sabha.
Yeah.
Thank you so much, Sabha, for having us. And also, I really like this topic that you're working on, sex education and, working for the adolescent girls. I would love to do something in my own capacity in this on this platform as well. And also, you have my consent to publish this discussion in your own way. And once again, thank you so much for having us and having this fruitful discussion. It was really nice talking to you.
Thank you. And hopefully you guys can have now a great evening. Enjoy your dinner. I wish you the best of luck with yoga. All right.
Thank you.
Take care.
Thank you. Take care.
Bye-bye.
Bye.